There are solutions right now that are helping to prevent stillbirth in America. Organizations like Healthy Birthday, Inc., that created the evidence-based Count the Kicks public health, Count the Kicks public health campaign that has helped save babies in 26 states. Cleveland, Ohio, Count the Kicks ambassador, Jasmine Abraham, shares how they're saving babies from preventable stillbirth. Jasmine.
Hi, it's wonderful to be with you guys today. Count the Kicks is a positive and empowering campaign that is so effective when it began in Iowa in 2008 that it reduced this stillbirth rate by 32% in over a decade. In the first 5 years of the campaign, there was a stillbirth rate reduction among Black women of 39%, which is incredibly promising. I learned about this program, unfortunately, too late. Our first son, Qasem, was born still at 37 weeks in June of 2020. Our pregnancy, we were completely normal as it gets. And halfway through my pregnancy, everything with coronavirus came around and half of my prenatal appointments became virtual. And because of that, I wasn't given all of the information that I needed. And I was told that my health network only provides kit counting information to high risk pregnancies. And since I was completely normal, I wasn't going to get that information. And so on the Saturday that I found out, I was telling my husband, I really haven't felt him move all day. He was a ninja. He moved so much every single day. It hurt. I was ready to be done. I was 3 weeks away from my due date. And that day I hadn't felt anything. And I called my OB. They said, go to triage, make sure everything's okay, just for peace of mind. And I went there and the resident looked at me once they got the ultrasound and he said, I'm so sorry. There is no heartbeat. It's nothing you did. And as a first-time mom, I am sitting here mortified that I now have to get induced into labor. And going through that entire process, it's long, it's drawn out. Your body's not ready for this yet. All to be able to see what you've been waiting to see for 9 months and to hear nothing, to hear complete and utter silence is one of the most heartbreaking things you could ever imagine. If you remember the birth of your first child and how joyous that moment was, now imagine that being robbed. And that day, a piece of me died with him and was buried with him. And no one ever told me to pay attention to his movements. I was like, well, he moves so much. And every day in the third trimester, it's a red flag if your baby's movement changes. That's the first indication that something is wrong. And so this evidence-based Count the Kicks campaign educates and empowers expectant parents to monitor their baby's movements every single day in the third trimester and speak up if they notice a change. If I had practiced kit counting, then maybe I would have realized that maybe I would have been able to save him. I would have realized sooner instead of at the end of the day that I hadn't felt him move that day. Research shows that more than half of all stillbirths, moms do notice a significant change in their movements. Just before their baby dies. But the fetal infant mortality review programs across the country tell too many moms that they were just like me and that they didn't know that this was an important warning sign. When moms are educated and empowered to speak up about a change in movement, then doctors have a chance to investigate and intervene. Taking that time to do one NST, to do one BPP ultrasound to make sure that your baby is okay is nothing compared to being able to save the life of your child. The solution is so simple and so easy to understand and so effortless. It sparked a systemic change in Iowa, which is incredible, and it expanded to 13 additional states, including Ohio, in partnerships with various funders and state organization health departments to help manage the care in these organizations. And the bright yellow posters and brochures are everywhere. And it's made to spark a conversation with their provider to talk about kit counting and the importance. Count the Kicks they created a free app that's available in 12 different languages, which is incredible. So it's not out of reach for anybody. And it acts as a data download to support mom's intuition. I used the app in my second pregnancy with my daughter, Aya, and I am a proud new mom to her. And being able to see what can come from a pregnancy, a positive outcome after exactly what Adam said, holding your breath for 9 months. It's excruciating. It's a matter of if this baby will come, not when. And Count the Kicks is just an evidence-based solution that helps put mothers at ease. And something so simple can help many stillbirths be prevented. And if Congress votes to pass the SHINE Act and provide the needed resources so that states can support highly effective programs like this one, just look at some of these faces. Count the Kicks has collected nearly 100 safe stories, 100 families that have not had to join the club that we unwillingly had to join. And for moms across the country who can use this program to save their babies' lives. Parents deserve this information and deserve to watch their babies grow like I'm getting the chance to now. The SHINE Act can help bring stillbirth prevention efforts to all 50 states. Thank you so much for allowing me to bring this information to you. Marjorie?